We thank you for staying tuned. It is still the conversation here on Lagos Television, and on this side we are turning our focus to a very important health issue. And this health condition affects millions of women worldwide, and I am talking about polycystic ovary syndrome, which is popularly known as PCOS. Now, despite its prevalence, many women remain undiagnosed or unaware of how it affects their reproductive health, hormones, and overall well-being. To help us understand what PCOS really is and why it matters and how women can seek help and support, as well as its symptoms, diagnosis, and treatment options, especially for us here in Nigeria, we have with us Dr. Oladotun Oyekon Omosonya. She is a fertility specialist. You're welcome.
Thank you.
And joining her also is Dr. Shomefun. Did I get it right?
Shomefun, yeah.
Shomefun. Shomefun Ibiyemi. She is a public health enthusiast and anesthetist. You're welcome again.
Thank you.
All right, we are talking about PCOS. I know many people have been hearing PCOS. I may not really understand what this health condition is all about. So tell us, what is PCOS and how prevalent is it on the side of the globe?
Okay, PCOS is polycystic ovarian syndrome, and it's an hormonal condition that is found in women of reproductive age, and that is between age 15 to 49. Okay, it's usually noticed in the adolescent age group, but these signs and symptoms can fluctuate and worsen as time goes on.
All right, so this happens to women in reproductive health age, and that is from 15
To 49.
to 49 years.
Yes.
So that means when you have started seeing your menses, right?
Yes, exactly.
All right. So can we say that PCOS is considered a reproductive disorder or hormonal imbalance, or is it both?
I would say it's both, but it starts with the hormonal imbalance, which now in turn form a cascade of events that end up leading to reproductive issues. Like, for instance, because of the PCOS, okay, let's start by saying, aside women in productive age group, women that have a family history of PCOS or have a family history of diabetes, type 2 diabetes, are at risk of having PCOS. And this is because there is a genetic predisposition of insulin resistance in both PCOS and type 2 diabetics. So people who have a family history of one or both are actually at risk of having PCOS. Do you understand? Okay, so having that in mind and knowing that, I said earlier on that PCOS causes hormonal imbalance. So this hormonal imbalance will lead to a cascade of events such as irregular menstrual flow or complete cessation, absence of the menstrual flow. This in turn leads to an ovulatory menstrual cycle, that is, in their cycle they are not ovulating. Now that has led us to the reproductive aspects. That's the reason I said it's a combination of both, and one will lead to the other. That is, the imbalance will end up leading to a reproductive issue.
These are symptoms of
Yes,
PCOS.
yes.
All right. I'd like you to also address early warning signs of PCOS that patients often ignore.
Okay, so most people have, like she was talking about, anovulatory cycles. So sometimes they do not have menstrual periods. So you have like somebody who has attained menarche, that's who has started seeing their menses. Then all of a sudden they just
It ceases.
ceases. So for some time they won't have menstrual periods for like 2 to 3 months. Then it also comes in sometimes people have just cyclical changes. Some people feel like they feel bloated, they gain weight. Some have excessive body hair as a result of,
Because I was going to ask, are there signs, physical signs?
excessive body hair as a result of polycystic ovarian syndrome also. So those are some of the things that manifest physically as PCOS.
I saw someone say she has a husky voice. Is that part of it?
Yes. So they sound a little masculine.
Masculine.
Yeah, and that's because they have excessive androgen levels like testosterone that is usually found in
Men.
yes. So they have a male head distribution. You see beards, mustache, chest, hair. Hair
In
distributions, yes, hair
abnormal
in
places.
unusual places that you usually see in men. You see these women, ladies, having such hair distribution. Okay, so those are like signs that. Then acne. Yes, she said no. Yes, acne. They have acne that are not responding to the regular facial treatments. They just once they use it, they see it coming back. Usually cyclical. Do you understand? Yes, those are early signs, like you said, that should be watched out for. I remember I said it can be picked at adolescence, but most times people try to know later as the symptoms worsen, especially when they want to have children and infertility has been discovered. What's causing this infertility, then probe further, whereas there have been signs all along that has been ignored.
And so these symptoms, does it appear the same way in every woman or it differs?
Okay, it differs actually. We've seen people with PCOS that are slim and just have the people usually watch out for the obesity, not necessarily full-blown obesity. It could just be truncal, just around the belly. And this person looks like she should look for age. Let me put it that way. The body mass index is appropriate and all that, but you're seeing truncal obesity that is around the trunk. Yes, those are also the other signs that could point at, yes, PCOS is going on. So and for some people, it's the full-blown obesity with acne all over, the hair distribution, and all that. So some even have normal menstrual flow.
Normal menstrual flow.
Yes. And it's when they start probing for causes of infertility, maybe via the transvaginal scan or something, that they see the way the ovaries are appearing. That's when they know that, okay, this is PCOS.
Okay, so aside or beyond reproductive health now, is there any other part of the body that PCOS also affects? Does it come with pain?
Okay, so so we have what we call non-communicable diseases, and globally now we've started seeing obesity as a non-communicable disease because it leads to other problems, hypertension, diabetes. And if you remember when she earlier said that people that have PCOS have some genetic predispositions with families who have type 2 diabetes mellitus. So because they have some insulin resistance in PCOS, so they also are likely to have hyperglycemia and become diabetic. So you might not see it as just being having fertility issues, but then when you think about diabetes, then also dermatologically, acne is a problem. It's a major problem for females. You don't want to have any spot on your face. So because it has both physical and psychological aspects to it. So that is also like a physical manifestation of PCOS. Then some people just feel like they are not eating, because you have some people that because of their size, due to the hormonal imbalance, they are on the big size. So they will tell you that they are starving themselves. Despite all they are doing, they are not losing the weight, not knowing that the problem is actually with the hormones. So that's another manifestation of PCOS, aside the regular fertility or infertility side to it.
Let's now talk about diagnosis of PCOS, especially here in Nigeria. Since you're in the health sector, what are the challenges that come with the diagnosis of PCOS on the side of the health practitioner and, of course, the patient as well?
Okay, when you talk about challenges, okay, let me take the diagnosis criteria, then I'll use that to explain the challenges. So usually we would say the patient should have at least 2 of the following: signs and symptoms of excessive androgen levels, that is the acne, the excessive hair distribution. Then on transvaginal scan, you're seeing polycystic ovaries, that is the ovaries looking like a big balloon with other small balloons at the peripheral. Okay, and also when there are eye hormonal levels such as testosterone, anti-malarial hormone. So imagine a patient that has had normal menstrual flow. Okay, I did mention irregular or absence of menstrual flow. Okay, she has had normal menstrual flow, no abnormal hair distribution, and she probably, her voice sounds like you said husky kind of, but she saw it as okay, maybe it's hereditary. Women in her family speak like that, and she has never had cause to do an ultrasound scan, and she comes to you for infertility issues, and you are telling her after your investigation and your history taking that she has PCOS, and she's telling you no, her period has been normal. In fact, she was pregnant one time ago, but she was not ready, and now that she's ready, it's not coming, that it can be PCOS. She has heard that PCOS, women with PCOS can't conceive, they don't see their period. Remember I mentioned she's seeing a period. So you have to do a lot of counseling. You have to start explaining how it differs from one individual to another. So that even takes you out of your just offering medical treatment. You're also helping with the mental health. In fact, some breakdown, they see PCOS as one very big diagnosis, maybe it's occurable, stop them from having children. So you have to do the counseling, prep them mentally, let them know there are things to be done that can make them achieve conception before you now start talking your treatment per se. So at the side of the healthcare practitioner, you need to be ready to do a lot of mental preps, a lot of counseling, and for the clients, you need to they themselves, like I said, I've heard so much misconception about PCOS. So they need to be open to the knowledge that there are ways out of all they've heard that PCOS can cause.
So talking about misconceptions now, I'd like you to address some misconceptions about PCOS, especially the ones you have come in contact with patients.
Okay, so you have like a young person, maybe she's 21, 22, and then she's probably just getting out of uni, and she's heard, oh, that people with PCOS are not going to have children, like she said earlier. And then she's worried already and that she doesn't have a partner. She starts looking for somebody or try to get pregnant. And then because I've had like a couple of people like that, and I just tell them, just breathe. Just breathe, because you have your whole life ahead of you. So don't think because you have a PCOS diagnosis, that means that
it's not the end of the world.
Yes, you should stop, because there was somebody who just felt the next thing she should try to do with her life is try to get pregnant because she was 22 and then she's having PCOS. And I said, it's not the end of the world. There are people with PCOS. PCOS is a diagnosis that you manage. It's not a one-stop thing that...
There's no cure?
Yes, you just have to manage it. So it's not, I treat it and it's gone forever and ever. No. It's something that you have to manage. So we can walk with you through it and not just come and go. So that's one of the misconceptions. Then there's this thing in our society, especially when females are usually embarrassed because of their body hair. They call them gorilla. In fact, I've heard somebody say you look like a gorilla because they have plenty hair around them. And then it's already making the person feel bad. It affects the person psychologically that they are calling me a gorilla because I have this diagnosis. So those are like the way our society sees them. Then if you're having that diagnosis and then, for example, you're getting married and one of your in-laws know that, oh, you are having PCOS. We live in a society where it's so, fertility is very key in this part of the world. So for some people that might be a hindrance to even the whole marriage process in the first place. But we are out here today to say, just because you have somebody suffering from PCOS in your family, or there's somebody that you know having PCOS, don't label them infertile because of that.
So talking about fertility now, you are a fertility specialist. Can women with PCOS still have children?
Yes.
Okay.
Women with PCOS can still have children. All those signs and symptoms I mentioned earlier can be managed. Both the irregular menstrual period, there are medications that can be used to correct and manage that. Even the ones I said might have absence of
Symptoms.
periods, yeah, that can also be managed. And in terms of conception, there is the option of in vitro fertilization, that is IVF, where hormones are used to manage all that PCOS comes with. There are even supplements that are designed particularly, specifically for PCOS patients. Supplements like Fertilovit PCOS, there are a lot out there that are designed to manage all that I mentioned earlier that PCOS comes with. So using this supplement, help of in vitro fertilization, yes, women with PCOS can conceive.
So when we are looking at the treatment options, management, how, let's look at it on the financial level now, knowing the condition of the economy at the moment. So how affordable is it?
Okay, yes, it's affordable because most of this treatments are kind of managed per cycle. So it's not something that you just keep using blindly. Okay, we can say, okay, you'll be on it for a month or even lesser than that, depending on what we are trying to address in the age of the PCOS. Okay, so if it's to regulate the period, oral contraceptive pills are not expensive, very affordable. That can be used to regulate the period. If it's supplement for conception, we have half a month, we have a month packages that are very affordable. And if you don't want to go through the long route or that of the supplements, the oral contraceptives and the likes, and helping the ovaries to respond to ovulatory hormones, if all that are not giving the result expected, then that's when you start looking into in vitro fertilization. And we have affordable options when it comes to, yes.
Affordable options. This conversation will continue shortly right after this break. Stay with us.
Lagos is more than a city. It is energy, it is culture, it is the possibility that makes this Lagos different from others. On this lagoon, from the 3rd to the 5th of October, the world's first all-electric power boat championship, the E1 series, comes to Africa and no other place but Lagos. The E1 Lagos GP is more than a race. It is a celebration of innovation, sustainability, and the spirit of our people. It is Lagos tourism at full. Join us as Lagos makes history. This is Lagos. This is the E1 Lagos GP.
We're still talking about PCOS, symptoms, diagnosis, and treatment options. And we still have our guests with us here in the studio. And just before we went on that break, we were talking about treatment options. And I asked the question, does it have a cure? And the answer is no. It is a condition that can be managed. And so, still talking about PCOS now, how important is it for early diagnosis, especially when you said some people have normal, regular menstrual flow, there are no hairs on their body, no husky voice. It is when they are now trying to conceive that they begin to go for, like I wanted to say investigation now, begin to run tests, and then they find out that they are down with that condition. So how important is early diagnosis? Do we just have to go and start testing ourselves when there's nothing wrong with us?
Okay, I think it would be good to note that aside the norm, that there are other variations or things that can happen with the menstrual cycle. I've seen people assume that the only menstrual cycle length there is 28 days. So that shows the information out there. Our public health enthusiasts can also help us with that, letting people know that when you notice some certain things that are out of the normal, then you should ask questions. You should know why these are happening. And let's take the acne, for instance. You're having recurrent acne, using all sorts of things. Once you use them, they clear off, then they come back. Then you should try jumping from one skincare product to the other shouldn't be the next. You should be asking questions, trying to see a dermatologist or even a gynecologist to know what is happening.
On top of acne.
Yes. You shouldn't just keep jumping from one skincare routine to another. Let's try this product. Your friend recommend this, you switch to that. Your colleague recommend this. No, ask questions. There is more to the skin than just what you apply. The skin has a blood supply. A lot goes on beyond just what you apply. So you should ask questions. Same thing goes with you, like she said earlier on, you are not eating so much, you are adding weight. Then don't just take it upon yourself to starve. Ask questions, see a doctor, why is this happening? So those are things that could actually help, and putting the awareness out there. Those are things that could help catch it earlier on, not just when you are now trying to conceive, maybe later in life, and that's when you're finding out that you have polycystic ovary syndrome. So,
all right, now let's talk about, you have established that it is a condition without a cure, and so let's talk about how to manage this condition.
Okay, like she was talking about earlier, that you start with coming with your symptoms and then we having to do investigations.
So I was right when I said investigation.
yes, you are.
Yes, you were right. So like your hormonal profile, doing a transvaginal ultrasound scan, those are the things that help us to pick up, note that diagnosis is actually what is wrong with the patient. Then when we do that, so depending on the individual, so the individual is what determines the kind of management. So she was talking about oral contraceptive pills, but that does not mean that once you think you have PCOS, just go and buy oral contraceptive pills and start using it. Your management is tailored to your person. So because yes, it's tailored to the person. Some people have hyperglycemia with theirs, so you can't just say, oh, it's just this or that. It's
not one size fits all.
No. We look at a patient holistically. So it depends on who comes in. That's what determines your treatment or management. And especially what stage you are in your fertility journey also determines your management. So if you are not somebody that is currently looking out to have a child, it's a different approach. If you're somebody that wants to have a child now, it's also a different approach. Yeah.
So again, can women who have had children already still come down with PCOS?
Okay, so there are, I'll answer the question this way. So there are women with PCOS that have children.
Normally.
Without knowing that they even had
PCOS.
Yes, without knowing they even have PCOS. Okay. Some of them would have had maybe one or two. And when they are trying again, it's not happening. Okay. Remember I mentioned at the beginning that it starts at adolescence, but it fluctuates and worsens over time. Yes. And in conditions generally, they are mild, moderate, severe. So there are people with PCOS that have children without intervention because it's not as, let me put it, it's mild compared to that of their counterparts. Where there are people that have one and they can have again, and that's when they know they have PCOS. And there are people that nothing at all. In fact, before they can see their menstrual flow, you have to induce the menstrual flow with medications, or they have to go on a weight loss journey. That's one aspect of PCOS management, lifestyle modification. You need to work on their diet, you need to work on their weight, you need to place them on supplements that would help the ovary respond to hormones. So those are, let me call them severe now. Those are the severe cases where you really have to intervene.
Is surgery
and
also
help
one
them.
of the treatment options?
No, not really.
Okay.
Only if there are other things that are coexisting with PCOS, like people that can have a combination of PCOS and endometriosis.
I was about to ask.
Oh, you were about to ask that.
There's a link.
No, but it can coexist. So in people like that, when you have an endometriotic cyst, or you have endometriosis, just basically means that the lining of the womb is present outside the womb, that is outside the uterus. So in cases like that, that is a combination of two things you don't want to have. So in cases like that, they might need surgery to help with the endometriotic cyst, especially if it's one that is severely symptomatic. So that in cases like that, yes, surgery can be an intervention. But depending on what phase you fall into, that will determine the severity of the intervention you need to conceive. So yes, women with PCOS can actually conceive without intervention, but depending on how severe, yes,
the situation is.
The
Okay, I'd
situation.
like you to, public health enthusiast, I'd like you to talk or place your weight strongly on this, because we find ourselves in a society where we are so big on fertility. Someone gets married, and in the next 6 months to 1 year, the womb watchers are watching.
6 months is a long time. Womb watchers start at 3 months. They'll be telling you, is the tummy not getting bigger?
You know, and so for women who have this condition now, what do you advise the family members? How can they support her? The husband, the in-laws, how can they support? Because again, this alone would have so much pressure on her mental health. So what are you expecting of family members to do to support people who are living with PCOS?
Okay, so living with PCOS it's a lot of struggle, because the individual is trying to do everything to attain a level of health that is difficult to attain, and it's really about providing support. Because I've heard people say, you are just eating all my brother's food. That's, you're telling somebody you're just gaining weight, you're just eating all my brother's food, instead of you getting pregnant. And you don't know that the weight that she's gaining is not even because she's not eating. It's because she's having a condition that is making her gain weight. So it's just a lot about people watching what they say. And when you see somebody having struggles, just be kind to people. Be kind to people, because you don't know what they are going through. So it's really about, sometimes you don't even need to know what somebody is going through. Just be kind to people naturally, because a lot of people in our, number one, in our culture, we don't mind our business, which can be good and can be bad. Because the good side is people rallying around to help and support you. But then the bad side is, even when they know your business, they are not supporting you. They are saying it all over the place, and then they just give you a label, a stamp that this one is a certain way. So it's really about being kind to people, then helping them, because they may need some financial help, financial support, so you can financially help them. Then you can stand as an accountability partner, because by yourself, sometimes if you have to go to the gym to lose weight, if you have to eat healthy, taking vegetables, sometimes it's difficult.
Easy, yeah.
Because I've also tried it. It's just difficult. But if you have somebody that is, oh, so have you done this where are we today, and all of that, it makes things a bit easier. So yeah.
How about husbands?
Women with
PCOS.
Yeah, you're supposed to be the number one supporter. You're supposed to carry it on your head like this. Because you vow to protect, love, and defend. So you're not the person that would come, and when you see that your wife is struggling, don't go and bring ice cream to come and tempt her in the house at that time. Yeah, for example, I'm just saying that. But you should carry your wife on the head and defend her from the prying eyes of the public, and also be like a safe space for her to come and just be vulnerable with you, that I'm struggling. And because sometimes for women going through a lot, even they don't see themselves coming out of that situation. But sometimes you just need somebody to talk to and just pour out to at that time. So those are like ways that
people
support.
can do. Okay, In terms of awareness, we know that a lot of people have been talking about PCOS. If you compare to like 10 years ago when people were not really aware of this health condition. So in terms of awareness, where are we as a nation?
Okay, I think like you said, the awareness is better now than it was 5-10 years ago. In fact, some celebrities that have the condition talk about it freely, yes, and how they've been able to navigate them living with PCOS, starting their family with PCOS. So I think the awareness is better, but it can never be too much. So we need to keep talking about it as much as we can in health gatherings, conferences, maybe chipiting, women health, in church, yes, thank you, in churches.
Religious centers, mosques.
Churches, mosques, religious centers, talk about it. Then the truth, let them know, like I said earlier, there's a lot aside the normal 28 days cycle, menstruate for 3 to 5 days. There's a lot out there. You'll be surprised at what people know. Some even believe every woman ovulates on the 14th day. They don't know. Yes. So I think education, generally, public awareness, schools, churches, mosques, anywhere there is a large gathering and PTA meetings. There's a large gathering. Remember I said there are people that will even have 1 or 2 and they're trying for the third and it's not happening. They're wondering what's going on. So like she said, PTA meetings, gatherings generally that involve women.
Finally, what advice will you give a young woman who has just been diagnosed with PCOS, especially when we are we are so religious and superstitious, not my portion syndrome? And so have you had cases where, you have just diagnosed the woman and telling her that, oh, you have PCOS, and the reaction is like, oh, it's not my portion, How have you handled it?
Yes, I've seen that happen. Say, it's not my portion in Jesus' name. I rejected the God of so. It has, yes, I was laughing when you were saying it. That actually the God I serve will not have peace. I reject every spirit of it. I was just looking. I allowed her finish. Even the husband started praying along.
There's nothing bad in prayer, though.
Yes, they took their time. When they finished, I now went back to the image on my screen and explained to them that it is not a dead sentence. It just means that you have this, like you told me yourself in the office before we came into this car. And also, that your ovary looks this way. Remember I described it as the ovary looking like a balloon with smaller balloons at the peripheral, at the edges. That's what that means. So I said, can you see for yourself that is how your ovary looks like? And those symptoms also goes with what we are seeing on the screen. So I'm just telling you what is. I now likened it to a fair skinned woman and a dark skinned woman with the use of sunscreen. I said, a dark-skinned woman can do her morning facial routine and maybe forget to apply her sunscreen. And the walk from maybe her office to her organization car park is sunny. She can wing it, just enter the sun, walk to the car park and drive off. But a fair-skinned woman, very fair-skinned woman that forgets to use her sunscreen, she might have sunburn. She might not like the way her face will be looking reddish by the time she gets to her car. I said, so it is a variation in your ovary. That was the way I ended up painting. It's a variation. Yes, it's a variation in your ovary. And because your ovary is looking like this, you now have to go through all these signs and symptoms you are experiencing. And you need these interventions, just the way the fair-skinned woman needs her sunscreen. So that was the way I was able to explain it to them before they stopped their casting and binding.
So while you are casting and binding, still seek medical
attention. Don't just wait.
They can go very fast, so
of course.
Yes.
Faith without
pray.
work.
Exactly. Faith without work is there. So they can go.
Once, thank you so much, Dr. Oladotun Yekon Omosanya, for sharing your time here, and Dr. Shomefun Ibiemi for sharing insight on this critical topic. It is one that we must have conversations about. Thank you again. We've been
Thank you for having
discussing
me.
PCOS symptoms, diagnosis, and treatment options. And I believe that everyone who has watched this has learned a thing or two about PCOS. The conversation continues after this. Stay with us.